All right, thank you, Rena, and welcome to today's webinar, Co-Creation, Greater Than Youth Engagement? I'm so thrilled to be doing this. Our last webinar was literally like the most fun I've had on a webinar, so thanks to all of you, and thanks for coming back, and thanks to new people. Let's test out technology. Can I get hands from people who have been here before, who were on the first webinar or in the prior one? Raise your hands, please. Look, I'm seeing a whole bunch of hands going up real fast. Eileen and Hannah and Connie, everyone checking out hands, Rena, Sally, ooh, and a lot of new folks as well. Thrilled to have you either way. Here's the thing though, I'm going to jump right in. And I want us to get started doing something really interesting so nobody falls asleep or starts looking at their email right away. So, can you see what I've got on the screen here? PB Bunny 97 presents, and the little subheading under YouTube says OOTW Late April. Does anybody know what OOTW means? I would like you, oh, Kristen Taylor, how do you know that? Will you type? And does anybody else know? I'm totally jazzed that Kristen Taylor knows what that is. Ooh, awesome. Anybody else? Anybody else? If your hands are raised, maybe you know too. I do them all the time on Snapchat. Oh, sweet. Here's Kristen. Can everyone see these comments? We've got Haley who's talking about, she's doing them on the, I have a lot of friends who want to be Instagram models, haha, so you're going to know where we're going with this. And folks that aren't, if you check out the right-hand column of this YouTube screen grab, you can see that there's quite a few of these. And this is apparently a thing. Kristen Teipel and I, when we were doing our adolescent development, training development, we started talking about, we began our relationship with PB Bunny here, and I want to show you the actual video from way back in the day. Do you see, anybody see a date on this one? 2012. It's about 4 years after she started, so she'd been doing it for a while. But here, we're only going to watch a little bit of it, and what I want you to think about as you're seeing this video is, what the heck does this have to do with marketing the adolescent well visit? All right, PB Bunny. Rena, I'm looking to you to give me an audio check when we get there.
Okay. It's Monday, and today I'm wearing my hair just straightened and down, and I just left some in the back. So I'm going to show you. For my shirt, I'm wearing the shirt from Forever 21, and for my makeup, it's neutral while I'm showing you. And then my earrings are from Forever 21. My cross from an Etsy shop, which I'll link below. Nails just nails are from China Glaze. My bracelet from J. Crew, the pink one, and other one is from Forever 21. So my shirt is from Forever 21 also. It has gold specks in it. My bandeau is from Wet Seal, and my skirt is from H&M. And that's what I wore on Monday. Holler, yeah. On Tuesday, I wore kind of more intense. I wore it with some eyeliner in the bottom. I smoked out with eyeshadow. Ears from Forever 21. Necklace from Etsy, which I'll also link. Same nails. And for my top, I'm wearing, you can just kind of see it now, the shirt from Nordstrom with a cardigan from Banana Republic. Oh, hey, Mom. I'm wearing jeans also from Nordstrom and a belt from Forever 21. And I just wore black sandals with this outfit, I believe. So,
all right, enough of PB Bunny. Look at Bessie saying she's giving free ads to all of those big stores. Is it? Do you think PB Bunny's making money? And she is. Today, PB Bunny. Where are my stats here? 387,000 subscribers to her YouTube channels. 58 million views, 1.5 million views on a single feed. What's the right word? Download, stream? I don't know. I'm a little out of it. How is the sound to everyone on videos coming up? If you're having any trouble hearing, let us know in the chat box. Absolutely. I saw one note that you couldn't hear it, didn't know what to do about it. I forgot to mention all technical issues go in the chat box so Rena can help us resolve them. Okay, so here's the question. PB Bunny, awesomeness? Wow, or oh boy, I don't know. Go into the little thing that has the megaphone or the loudspeaker. Give me a yes if you're thinking PB Bunny awesomeness, a no if you're like, oh boy, I don't know. I'm seeing some no's, I'm seeing some yeses. Awesome, we're kind of split. I got some Still got some hands up. I got people who are not, nobody wants to weigh in. Nobody wants to weigh in. No, not for me. Can somebody who's saying no, wish there was a neutral button? Can I get a no and a yes response in the chat box from folks who are having an opinion one way or another as we keep going along here? So you saw right away from some of our colleagues on the phone that this whole outfit of the week is a thing, that Instagram is being used for a variety of reasons, not just here's what me and my friends are doing, but to show off their clothing, to do all those stuff. And somebody even also jumped on and said, these stores are making money off of her. And that's what's fascinating to me about the turnaround on this is that, in fact, PB Bunny has turned this into a full-time career. You get money if you get enough views and all that sort of stuff from the views, and they place those ads in the front so that they can make money. And she's turned this into a living. She lives in LA and is sort of running around doing all this exposure for different brands, different companies, et cetera. Okay, these comments are awesome. Here I want to scroll back through. I'm seeing neutrals. I'm seeing it's geared more towards youth. Yes, for teens who relate to these concepts. No would be for more gender neutral. Agree, don't feel this is where she should be as a young adult. Not sure as a mother. Fascinating. So we could have our own focus group on the reactions to PB Money, but here's the deal. Young people are using this medium more than anybody my age, or I suspect many of your ages, I know a lot of you all are young, than any of us are. In fact, the demographics have flipped, right? Much less use of TV than YouTube. And this whole system is set up now to support what they want and what they need. So when I'm going back to what does this have to do with marketing the Well Visit, that's my first creative challenge to all of you. Here it is. The mashup thing. This is what we're using as a creative brainstorming device as we go through these webinar series, right? It's a creativity device where I'm asking you to think and put two things together to come up with fabulous ideas on the back end. And what I'm wondering here is, if we know that young people are developing their own videos, their own careers, their own way of communicating with young people using technology and creating this stuff, is there the opportunity to use that trend, that ability, that capacity, that interest to help support our Well Visit marketing? I'm going to not talk for 90 whole seconds. What I'm looking for people to do is just generate as many ideas as you can and slap them into the chat box. What we've been doing with these calls is we take all the ideas, we dump it into a big document so everybody can walk away and have something to think about, use, generate new ideas, et cetera, et cetera. Easy question, what is this a mashup of? Who recognizes what's in there? Oh, and I'm loving these ideas. Yes, indeed. Simpsons plus Pokemon, that's that mashup. Pokemon and Bart, exactly. Okay, so look at all these cool ideas that are coming in here. Ooh, ooh, ooh. A Well Visit never looked so good. That's awesome. Okay, wait. Great for teens, on trend. What will she wear at the Well Visit? Oh my gosh, that's hilarious. Could we get fashion bloggers to talk about, like, not just outfit of the week, but outfit of my health routines? Love it. Pikachu, have PB Bunny talk not about what she wears, but what she's doing to be healthy, like dog, dental, and safe sex? Absolutely. Cool idea, like kind of celebrity spokesmodel. And that, in fact, is super on point with a lot of the marketing research, right? That people are way more likely to listen and trust PB Bunny's fashion sense than, I don't know, like name, generic supermodel X. I love this tagline, a Well Visit never looks so good. All right, all right. Good ideas. Anybody else? The videos, using the videos, what healthy actually looks like, contests where youth create their own marketing videos, paying YouTube stars for sponsored videos, right on, digging it, absolutely. Would there be room would there be room to talk about actual health experiences in these things? I don't know. Oh, Jenny Baker, work with sex-positive rock star Lacey Green on how to access birth control and testing. Absolutely. Tie her focus on looks to health themes. Feel goods, look good. Awesome. All right, you guys, way to get the brains going. More ideas, just dump them in there. We're going to keep going. I'm going to back up a little bit and tell folks who are new to this what the heck this is all about. But thank you for jumping in and being creative to start. All right, where are we going now here? Greetings from Minnesota. Most of you know me, but I am sitting here at the University of Minnesota inside the medical school, inside the Department of Pediatrics, inside the Division of General Pediatrics and Adolescent Health, and at the State Adolescent Health Resource Center. And you can see my Gopher Minnesota Pride. I don't know if you all saw this, but our Gopher women's softball team won the Big Ten softball tournament title. We're very, very excited about that here. Most of you also know, and Hannah, I see your question, which is awesome. I'm going to come back to that. Most of you know that this whole series is sponsored by the Adolescent and Young Adult Health National Resource Center. This is a collection of professionals who are dedicated to working with state health groups who are making a priority of increasing the well visit rates of young people. National Performance Measure number 10. That said, this idea of marketing kind of applies generically across the board to many youth issues, but today we're really focusing in on the well visit. All right, I want to back up to Hannah's question. How do we play on this energy without perpetuating a conflation of health and an unattainable singular standard of beauty? Thank you, Hannah. I'd never resolved the do you hate this, do you love this thing, and we kind of push this to see if we can get to this discussion, right? Like, is it awesome that she's leveraging that beauty to make money and give herself awesomeness, and is it perpetuating the bad stuff as well, and how does that go? So right there with you, and I think some of the other folks who jumped on with other possible role models might get some answers from this as well. But that's another webinar. We're going to save that for another day. Other folks who have ideas, though, please jump in and add them. I think you're getting the idea already. This is not going to be your typical webinar because despite the fact that I'm sitting here in academia, my background is in marketing and advertising. And so I'm trying to bring those kind of perspectives into our discussions around promoting the well visit. I've lately tried to find new ads to show you all because so many of you have seen all the same boring ads from me. Here's a new one. Here's TV since we have the opportunity. I'm going to show you a 30-second spot that I got to do in my youth.
Nature never ceases to amaze. Here in California, snacks grow on trees. We call them Blue Diamond almonds. And remarkably, they're as delicious as they are nutritious. Still more remarkable is the fact that each and every almond tree produces 52 cans of almonds every year. Exactly a can a week. So please, don't upset the delicate balance of nature. Eat a can a week. No more, no less.
That was the fanciest TV commercial I ever got to make. We made 3 versions of this. It cost $250,000. That was 25 years ago, if you get a sense. The reason I'm showing you this one is that guy in the frame, that's Bob Overton. You saw his wife Irma in the other slide. The reason we could spend money on advertising for Blue Diamond is because all of these growers like Bob paid a cent per pound of almond to have us do advertising for them. And as such, they demanded to be featured in their ads. As you think about the role that young people are going to play in what we do, imagine if they held the cards on the money. And would we be doing things differently? Sure worked for Blue Diamond almond growers. All right, folks who were on before, you've seen this slide. I want to be clear to everybody that when we talk about marketing the well visit, we are not just talking about making ads, promotional flyers, handouts, postcards, etc. Marketing really means the entire mix of things that it takes to get somebody to buy your stuff, or in our case, to actually have a well visit. All right? what you say about your product, the actual promotional stuff, the communications materials and all that is just one small part. And in fact, it fits under that area of promotion. Curious, who's doing something now? Can we get some comments in the chat boxes? Who is doing some marketing that's going on right now? I'm going to keep talking while you guys are typing just to keep things moving here. You know what I want. I'm hoping some of you were able to print or look at the handout that Rena attached. South Dakota is just getting started. Excellent. Looking for more here. So this is part of the handout. And what you're seeing here is this marketing analysis piece that we've been working on since the coins and the focus on National Performance Measure 10 started. I've got the whole thing right here. If you downloaded it, you're probably looking at this piece. This is the cover. This is some of the sources of the research that we're using for these webinars. The next page is giving some perspectives around young people's orientation to the well visit. And then we come back to this marketing analysis. Oops, I messed up this page. Just so you know, I've got a few different topics for you to maybe take notes on. It's totally up to you. I don't know if you're analog. And then we've got some sources. All right, so that's what you've got on this thing. But take a look at this marketing analysis for a second. What we need to be considering when you're thinking about how do we do marketing to increase young people coming to well visits is not just the product components that you see. I wonder if I have a pointer or something. I have a pointer that you see up here, right? Oh, I don't know. That's weird. Is that weird? I don't know. The product components, right? All this stuff in that gray box, that's all the stuff that comes out of the Bright Futures guidelines for what should actually be happening. Everything from the physical assessment to the immunizations to that, that strengths and risks screening, as well as the observation of the young people and their parent together, right? So that's the basic stuff we know happens in the well visit. But the other stuff that we need to be thinking about, we really are going to try to find a way to talk about and show value of this well visit, are things like, what do they get out of it, right? When they leave the well visit, they probably might have some test results in hand. Maybe they got some insights on a specific problem, right? But what are they actually getting out of it? These are things we've just been making up or assuming from our conversations. What are the actual benefits to them, right? You can see how we've put in here enable sports, school, job, sex, and I'm sure you're getting a sense of our the way I talk about these things, right? But are those enough? Are those compelling? And which one is actually the most provocative one? Look over here, too, at the product experiences, right? What is it like when they actually get there? Or the price, right? We all know that the well visit is free, assuming you have insurance, and most everybody does, or did, or will, or not. But is it really free? Right? The time that it is required to get, perhaps there's some emotional investment. Some of the research I've read has said that young people are a little angsty about doing this, a little awkward. There's always going to be concerns about the privacy factor, right? So anyway, this is what I'm trying to get us to consider is all of these things come together to make marketing. All right, we're going to look back at your answers now about what you're doing. I don't know, my window is not very happy. South Dakota is just getting started. Polly is saying yes. Video on movie theaters. Iowa's working on materials right now. Eileen, our initial project is for parents, caregivers, as it focuses on how to access insurance plus the value of adolescent well visits. So is Iowa. Iowa's doing parents and caregivers. I wonder if Bessie is doing movie theaters. Polly, South Dakota, are you thinking young people or parents? Give me a little type in there. But you can see again up here in this marketing analysis, there are multiple audiences that we could be talking about. And just because today I'm super focused on adolescents and young adults as the core audience, that does not mean that parents and caregivers or the systems of care or clinics is not listed here, but it should be clinics or practitioners or insurers or whatever. All of those are super valid audiences to be working on. And one of these days, we're going to have Iowa and others show us what they're doing with parent audiences. All right, so we've got some young people with that. For the youth in South Dakota, okay, lots of social media, and YouTube, fabulous. Okay, so just wanted to be clear, this is super youth focused as an audience. We will pursue some of these other audiences when we can. All right, where are we going now? Here's the challenge. Oh, I don't want to be there. Here we go. All right. From our initial webinar series on this, we really were coming to the conclusion that the well visit is a hard sale to make to young people, and to a degree to parents as well. There is no clear compelling benefit. What is the value of the well visit to young people? We don't know. It's named poorly, and people are very confused about what a well visit actually is, what it means. Is it a well visit? Is it a preventive visit? Is it a checkup? Is it an annual visit? Too many names. We've seen success coming from some states that are doing youth-driven marketing efforts. So we're going to be jumping off of that, and it makes the most sense from a youth engagement perspective and a sort of low-hanging fruit. But also we're wondering if there's a way to focus in on features or attributes or benefits or deliverables that really align with young people's values and sort of the pain points in their life, right? Whether that's acne or getting on the sports team or frustration with parents or relationships, whatever that is. How do we line up and match with those needs? So here's what we're going to be talking about today. We're going to be looking at some of that marketing research that I talked about. We're going to be looking at examples of youth-driven media projects, which are specific to that promotion category. But we're also going to talk about how could this work, thinking about how we might improve our product being the well visit itself. And of course, throughout, we're going to be referring to state-level examples. Tiffany is saying, I have 2 younger staff with me under 25. Neither of them have heard of the term well visit. Food for thought, absolutely. Checkup, annual checkup, anybody? Yeah, there we go. The other thing is, this could be totally regional, right? Minnesota could be totally, we're child and teen checkup, but New Mexico might be, no, this is the annual visit or something like that. A lot is going to depend on where you are and what has already been done. This was from the last session. I just wanted to kick this off with the reminder or the check-in with you all of where you fit on these generational generalizations. Ooh, easy for me to say. Where are you? Where are you in here? Right? I am firmly in this Gen Xer, trying to deny that I really could be in the boomer category. So it's possible that I could be the parent of an adolescent or a parent of a young adult, but my relationship to millennials and this founders iGen, Gen Z, where adolescents and young adults sit right now, no. That is not me. And what we're seeing from the marketing research or from what we're learning from the commercial marketplace is there's a really big difference in the attitudes and perceptions and how they think between millennials and Gen Z, as well as between older and younger millennials themselves. Interestingly, and this is something that I was right on top of, is that the parents of adolescents are millennials. As well, and so there's a lot of interest now too from commercial marketers about like how do we sell to millennial parents and what's that about, you know? So here's Michaela on the fence of X and millennial, depending on the definition. I know, right? Oh, we got some older millennials, fabulous. So if you are in the younger millennial or Gen Z, please jump in. I am old and presenting you stuff about young people, and that's just weird and awkward and kind of bad. So I need to be called on stuff, and you need to recognize that this is all through a giant filter. All right, look at this. Raised by an X. Well, I lost that. Identify with both. We've been called the Oregon Trail generation. Nice, Michaela, nice. Half analog, half digital. Right on, right on. All right, so more of these. Ooh, everyone's jumping in now. Excellent. No Gen Z, huh? Anybody Gen Z? Anybody wanna come out? Right in the middle of the millennials. All right. All right, so here we go. Take a minute. promised you to talk about this idea of co-creation. And what I'm wondering is co-creation different than youth engagement? What does that mean? What do we think so? What do we think? And I'm going to give you my opinion at the very end. Ooh, Sally. Take a minute for yourself. Jot down a note. Does it seem like, is this straight up youth engagement? Is it different? What do you think of what Sally said? And just hold on to that thought as we go through all this. Because at a minimum, it's youth engagement. At a minimum. Every single resource that I read and was able to get my hands on for free or low cost brought up this theme over and over and over again. PB Bunny was an excellent example of it, right? The way technology is today and the way young people are engaging with technology and media and content is way more about creating it than it is about simply consuming it. That's very, very different than it was for Gen Xers, boomers, even maybe older millennials. I think that they got it started, but now it is just the way young people function. This is super marketing, hipster language in here. But what I want you to see is the data that this is not just a play thing. This is not just a, it's not a surface thing. It's expressing themselves creatively, and it's part of how they function and engage with other people. I don't think we, meaning old people, meaning state health departments, can be the content creators when it comes to discussing health and well visits. I'm looking for pushback, but I want to give you my 3 reasons why I don't think it's us. Number 1 is super stiff competition, right? We do not have the skill set or the media dollars or the legacy of producing content of the quality of a Walt Disney, right, who might dominate and own how young people think about so many issues from birth through adolescence into adulthood, into parenting. We don't have the money or the skill set. We don't have the capacity to be on YouTube in an authentic, engaging, and relevant way, like Funny or Die. If you don't know Funny or Die, it's probably super famous comedians doing free stuff on the internet, getting people like Hillary Clinton, Brad Pitt, and Barack Obama to do this with them, right? You think about the fact that, right, like we're going to go out there and create new content about the importance of the well visit and put it on our websites or make a PDF and send it around to a couple of people. How many of those do you think exist? And are you the people or the place that young people are going to turn to get that stuff? Are you going to come up first in the Google search engine? Probably not. Probably WebMD, right? And what are the reactions to you going to be? We had a little back and forth about this at the first COIN meeting that was like, do young people trust health departments? Wyoming was like, they do for us. Other places heard absolutely not. Certain kinds of young people, absolutely not, right? But how do we know? And what is a natural path that they're going to go through to get this content? So I think that there's a lot of stiff competition, which makes me concerned about competing for information and knowledge being put out there about the well visit in a generic way. Number 2 reason, we're normies. Anybody know normies? Anybody want to jump in with a definition on normies? Or anybody want to jump in and tell people what this meme is all about? I've developed an obsession with Reddit lately, and a normie is a pejorative label for someone that Redditors, who are unconventional kind of techno people, deem too conventional or mainstream. And frankly, when something becomes mainstream, they don't like it anymore. This meme of SpongeBob looking like a chicken, does anybody even remotely understand what's going on in this? This was a tweet. Yeah, so like I spent 2 hours trying to unpack what was actually happening in this meme, because it's like I've seen this meme today, but I don't get it right. So Kristen, you're saying you're getting old. Oh my gosh, that's so funny. I thought you were going to say, yeah, this meme is getting old, Glynis, because it kind of is. Like it's like, you know, a month old, and so all the cool kids on Reddit are like, oh, that's tired and all that sort of stuff. And there's like super 20 levels of newness in here between the SpongeBob guy, birds with arms, and the way the letters are spelled out in the reply under the me thing. Like all of that has layers of stuff to the people, the young people that are doing this sort of stuff on the internet. And we don't get it. Even Kristen, who's way younger than me. Oh my gosh, Glennis, I'm cracking up with the idea. You read posting for the karma. Yeah, no, I'm too scared to too scared. And someday you're going to have to explain karma to everybody else, because that took me a week to figure out what that was. Here's another example of normie, right? Instagram filters. I'm going to assume everybody knows Instagram, and Instagram filters are the thing. It started with, I got the everyone's seen the dog and the nose and the tongue and the rainbow stuff. And it's a thing. 2 years ago for Chlamydia Prevention Day, we were doing hashtags. This year it was all about Instagram filters because hashtags were done for young people. And this is what happened this is a year and a half old, right? When the X-Men Apocalypse came out, they jumped on, they bought all these filters and shoved them onto everybody's phone right away. And young people were not happy. They're like, why are you forcing this? We want options. Don't be forcing us into stuff. I'm sorry, you're right. Those are Snapchat, not Instagram. Thank you, Amy. But why were they, they do not like being dictated to. Now, well, the thing is to have those filters up there. I do not know. But what happens when old people or really crass marketers jump in and try to subvert what young people are doing with their stuff, yeah, that's a violation. So, are we qualified? All right, I got to look back. There were some really cool thoughts. Snapchat have been huge for us. Polly, we would love to hear how you've used them. If you want to jump in on the chatting. For anyone wondering, karma is like, whose line is it anyway? Everything's made up and the points don't matter, but you want them anyway. Exactly. And doesn't it enable something? You get to do more things. I don't know. I just sent it to my youngest brother. Wonder if you'll take the time to explain it to me. I'll send you the link. It was on USA Today a couple weeks ago, or last week. As public health workers, we have to partner with youth serving services, organizations to develop our messaging if we want to get a share of young people's attention. Absolutely. Absolutely. You know where I'm going. You know where I'm going. All right, here we go. We're normies. No. Third is relevance. And this falls out of normies too. Like, can we ever be relevant if PB Bunny or SpongeBob or, right, all of that stuff is where things are at. Can we be relevant? There's a whole nother, the next webinar, Bessie's killing me. There's a whole nother webinar next time that's about getting to relevance. But look at this stat from Graham Brown. Millennials trust user-generated content 50% more than traditional media. They want to see PB Bunny, and I know PB Bunny is making some people nauseous. I'm totally right there with you, but apply this to anything that we know and see, right? And I am going to reach, and I'm not saying that people don't trust doctors or health systems. I'm just saying that the way the trend is going, young people online using technology are much more comfortable going where they're familiar and with their colleagues and friends. still looking for some pushback. Come on, there's got to be some doctors online who are who want to do some pushback here. Here we go. 3 reasons. The way young people are using this technology, the way they're creating content is happening organically and is meeting developmental needs, right? Fan fiction. Can I get some fan fiction friends up here? If you don't know what fan fiction is, give us a hands up so we can see if we need to explain it. Bessie will explain it. Right? So young people are going online to seek out and find a place where they can be skilled and awesome and do and create and master. And there's whole communities of young people around it that are doing the same sort of thing. And they're sharing and growing from that experience themselves. Right, I'm seeing some hands. Now I don't remember. Did I tell you if you did know fan fiction? I don't really know. I'm just going to leave that out there for people to go look up and find themselves. Go find some fan fiction. There's some that's not safe for work. Just to be clear, this was not one of them. All right. Given all of that, right? Given all the 3 reasons why, what has been suggested is that the right role for adults or marketers or public health agencies is to curate, not create. And what does that mean exactly? And for the sake of the day, we're going to spend a lot more time on this next time, but for the sake of the day today, what I'm wondering is, what role can we play in making it possible, right, for young people to do this themselves, specific to health and the well visit? At midnight, one of my favorite TV shows until it changed time slots, and now I'm all confused and that sort of thing. But they use their TV shows to feed into their Twitter to generate memes and engage around hashtags. What's our version of that? We can't make this stuff, but can we inspire it or link to it or support them to do it? What would this look like? So here's your next mashup challenge. How can we promote the well visit? And I am talking purely messaging, right? How can we get people to think about the well visit or understand the value of the well visit or know that a well visit is important? How can we do that by capitalizing on what youth are already doing in creating content? That's what I mean by organic, right? They're already out there doing this stuff. How can we take advantage of that? Where's a role for us there? Knowing that it's dangerous, knowing that we don't want to co-opt or shove ugly filters down their throats, what can we do? Again, I'm not going to talk for a few minutes. I'm looking for brains to work. Oh my gosh, am I freaking you all out? I'm not getting any comments. You never want to shill at Glynis if you haven't seen our Hale Corporate. I clearly know how to go to with my Reddit questions. No, I have not. I'm still unpacking meme economy and what not to do. All right, good deal. Are people like thinking now they want to go look at Reddit? It can be an ugly place. It can be an ugly place. What do you got? Am I freaking you out? What's going on? I'm looking for some ideas. They're already going to be doing it. How can we make it possible? How can we support them doing it? Oh, here's a tough one. All my ideas are like themed contests, but maybe that's uncool. I don't know. Seems to be a lot of people doing the contest, generating ideas like that. Absolutely. So the kind of things that I've been thinking about, capitalizing on where they're at and what they're doing. Are there boards or places where young people are already congregating to talk about some of these issues, right? And could we jump into those and be supportive of those? Or could we create a place where they could go and actually do that in a smart and facilitated way? Or could we be the answer people for when they're generating those questions? Or could we be the quality control check, right? Like we go in and read all the fan fiction, it's like, oh, you know what? Hermione really should have been thinking about a condom. Or, you know, okay, is anybody laughing? I thought that was pretty funny. I didn't know I was going to say that. You know where I'm going with that, right? I feel filters would be needed. Yes. When my advisor said give information to their peer and the activities they have to community and green hours, right on. So them being engaged, they're the workers. I'm really psyched about that idea right there, right? Can we digitize peer educators? I think that's what Susan's getting at, and I think there's so much upside there, right? Beyond just like having really cool celebrity spokesmodels, can we empower a whole fleet of young people to be the ones out there doing it? Could we ask great things your doctor would say, cool, not cool? Right on, right? And I love where Susan's going too, because we're getting now is beyond just the promotion of it into the product as well. And that's like such a home run, right? If you can be promoting the well visit at the same time you're like sort of adapting and influencing on the product of the well visit itself, oh, that would be really cool. All right, still looking for more ideas, more ideas. If I'm not giving good instructions, could you push back on that too, please? All right, thank you. All right, content creation, we've been there, we've got it. So low-hanging fruit is actually engaging young people in the process of making our promotional outreach communications materials. New Mexico awesomely did this, and that's one of the memes that young people created through, not surprisingly, a contest and a competition. How tough am I? I made a doctor's appointment without my mom. I don't know who that character is because I'm an old person. If anybody does know, please feel free to jump in. What do I mean by digitizing peer educators? So what I mean is, like, instead of training them to be like in real life, doing just in real life, talking to their friends about sex ed or health things or BMIs or whatever. Forget, I don't want BMIs. Oh, that's from SpongeBob? I did not know. I want them to do online, right? So anytime they're on a Reddit thread or on a board or in a chat room or perusing comment sections and they see inappropriate or wrong information, they could jump in and check it and send somebody to a good information source. Facebook Live with the doctor. You're welcome, Eileen. Okay, so New Mexico, you can tell that that's youth-generated. Let's contrast that to the one below, Better Together Hennepin, which was a campaign fueled by young people's perspective, youth engaged all the way through and through. But you can see by the production values that it's just a different thing, and it was produced by professional ad agency. I love what they did in New Mexico. It is like my most favorite, ultimate, best model, and requires certain skills and attributes and things at the state health department that you're going to need. So we'll talk about that. Here's a little bit of New Mexico. And again, just like Iowa, I want to get New Mexico on to give full briefing on how and what they did. But the thing that I wanted to point out is, just like somebody said in the comments, they ran this Web and Wellness Summit that embedded in it was this youth meme generator or youth media development competition. The winners were featured at their school-based health center conference. And in fact, they were engaging the youth-serving agencies to actually make all of this happen at a very grassrootsy level near the clinics that they were focused on increasing the well visit rates for. So it was one whole package, and so you can see their youth health literacy toolkit. They framed the whole thing around health literacy. You can see that they're not super highly pushing go to a well visit, go to a well visit. What they're pushing is young people engaging authentically, smartly, and interestingly, like they want to be engaged with their health. Therefore, a well visit. Again, little marketer's trick, right? Maybe aren't going to sell the features of the well visit. We're going to sell the category in which that thing belongs because the category is something they're interested in. I don't know if I still believe health is the one. Look at what New Mexico did up there, web and wellness, not purely health. We are using the toolkit. The summit is a great idea, absolutely. And this was all done, sponsored by Tessa and New Mexico, run through a youth serving organization. Logo developed by a young person, but also a professional graphic designer. Here's a bunch more of their work. Again, I just can't imagine that any of us would come up with any of this. Is that still SpongeBob and we give them insurance and they don't use it? Yes. Can we do this webinar content with our advisory youth to help us curate? Absolutely. Absolutely. But Jenny, the other thing I think about, and if there's young people on this call, like, it's weird for old people to be talking about this kind of, you know? And why is SpongeBob still a thing? I don't know. It's huge. It's huge. No, SpongeBob is not. All right, excellent. See, here we go. Here we go with the actual debates. We got our own comment section going on right now. Who needs to get vaccinated right here? Anybody? The memes are huge. Meme generators. Memes here, memes there. Evolution of memes. All right, pretty sure that's the Lord of the Rings guy, the bad guy. Or is it a new, yeah, what's the one that you guys everyone's watching with the dragons? I don't know. All right, that's how out of it I am. Game of Thrones. Is it Game of Thrones? I don't know. Anyway, here we go. Young people. Apps online, all of that sort of things. Good, thank you. I thought that was, what's his name for Lord of the Rings? All right, moving on. Cool stuff from New Mexico. Hands up if you want to hear New Mexico really give a whole detailed description of what this would look like. Can I get hands up? I don't think I got like 4 or 5 hands. Hands up. All right, that's enough hands. I believe you. Where do we go now? All right. Oh, sorry. New Mexico engaged a youth serving organization to run this whole thing as a youth program. That meant they had to have the money, and they used their coin money to pay the youth serving agency to do all of this work for them. It also meant that they had to have I don't know, what's the word for a state health department that would be willing to let young people create stuff like you're seeing on this screen without freaking out? Right? It's a luck. It's like it really is a great strategy, given all the things that you need to effectively work with young people and deal with this sort of stuff, right, with a contract partner, right? It's brilliant to outsource it. But it requires money. Or maybe it's an existing contract. I think that's what Michaela's trying to say. Okay, slides, move along. I want to contrast that to what Hennepin County did, and this was specific to sexual health, right, where what they did was hire an ad agency to create all of this work, and the ad agency contracted with young people to get their perspectives and input. This, again, was all sexual health. It was money left over from the OAH funding, carry forward, blah, 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 you know, all that sort of stuff. What they did was, what's wrong, Mr. Friend? They packaged this into a let's get young people to go to sexual health clinics. And, by the way, we were requiring you to engage them authentically in the process. They hired a youth leadership team. The youth leadership team did the formative research about how young people thought about going to sexual health clinics. They helped drive the evaluation of the creative products. There were about 2 or 3 rounds before they came to something that the young people thought was aligned with their values, beliefs, and interests. They helped pick the media, not only from the team, but from the team's outreach to their own friends on where they should go and what should be used, et cetera. The whole thing was driven around a clinic locator that was used by Hennepin County to entice clinics to have a quality product. You could not be featured on the clinic locator unless your clinic met the quality standards they laid out for sexual health clinics. And they would go in and assess your clinic. And they would give you the checklist for what to improve. And they would support you to improve what needed to be improved. If they did all that, or at least part of it, it would be included on this clinic locator. The locator had many features, again, done to set up, created to align with what young people said was important, right? We might think, well, of course they want the closest clinic, so we'll just generate clinic lists for the closest to their zip code. No, there were a lot of young people that were like, yeah, so no, we want the clinic farthest away from our house because we don't want our neighbors there when we go. So that's the kind of stuff that they were using in the clinic locator. All right, I got to come back to some comments here. Is there any way to work with schools to give students credit instead of pay? That might help create advisory panels without money. Absolutely. And what he found is like local public health tends to have really good relationships with schools. States a little more challenging, and they still are super frustrated by trying to get the attention of the school and having a good partnership with them. And that's the question is like, who in the school is our right audience for engaging at that level? Right? I was hearing a lot of people talking about how hard it is to get principals, right, and those sort of folks to talk about this, but they were having more luck around health issues with coaches or social workers or, you know, cafeteria workers, all that sort of stuff. And again, I think that's a whole other discussion that we could have about how do you actually get in if you're going to go that way with schools. Somebody else, we're going to talk to an ad agency about bringing youth in messaging to promote adolescent physical activity. Discussion should be interesting, as I'm not sure they've done this before. Right on. The VERB campaign actually had some very, it's old now, but it was some very useful insights that the ad agency might want to see as well. Awesome. Good luck with that. We would love to hear more. What is the name of the campaign? The name of the campaign is called Myself, My Health, and that's the URL as well. All right, so here we go, responsive design, first results. They had great results. They were also, so 6,000 clicks, it was what, 3 months or something like that. All the viewings, and then they, is it in here? Hold on. Yeah, there was a measurable uptick in the clinic visits. But we would have been happy with the 6,000 clicks. There's another huge thing. If you really are thinking about doing outbound media communications, your challenge is going to be metrics. Social media awesomeness on metrics, but can you track and account for them going to the clinic based on your stuff? That becomes another measurement challenge. Lots to say about that. Hit me up if you want to see some tools. All right, Jenny Baker. If teens ask their school admins directly, they seem to have better luck. Brilliant, right? So youth advocacy as the way in the door for some of these issues. Fabulous. Excellent insights. Really appreciating what you all are sharing through the chat box. All right, oh gosh, I'm sorry, going too fast. Okay, so that's the end of the Hennepin County example. And next what I'm going to go into is not just the communications, but how could we co-create around the well visit as a product with young people? Since we know it doesn't line up quite as well as we might want it to with their needs and their desires, how could we get there? By engaging with young people. But first, with this Hennepin County thing, just wanted to point out that Minnesota is doing more awesome work, and they really are talking about engaging the same ad agency to develop a campaign or rethink this project to work on the well visit. And, you know, would you want to use it? If somebody offered you, you know how the National Campaign for Teen Pregnancy used to put out all those template ads? You could just download stuff and run posters and ads and all that sort of stuff. Would you want that? Would you want that for well visits? I don't know. Send me a note. Oh, I saw a smiley face. Smiley face. Love it. If comes in Spanish. Yeah, I was hoping that was going to be a little bit of the pushback because I feel like it's going to have to be adaptable to so many different communities. Adjusted for each state's need, yeah, and and communities within the states, right? Like Minnesota is really committed to being intentional about reaching rural audiences or greater Minnesota audiences. And they're almost exclusively focused on Medicaid populations, which again means we might have to be way more attentive to community-specific messaging. I don't know. It's going to be interesting to see where it goes, but I totally agree with your comments. Thank you. Orders in, please. All right, here we go. How do we engage young people in improving the Well Visit product? Number one is they want to, and it soon is going to be a standard. Millennials, and I know that our new Gen Z folks are going to feel the same way. If I'm not engaged in this, if my perspective and voice and participation is not valued because I am a content creator and I know what I want and I know how to get it because I'm a master of technology, if they're not engaged in it, I don't think they're going to be particularly interested. We're seeing a big shift from these marketers on how do they live up to that, because that's not how it tended to be. Coca-Cola is one of them, right? Sugar-sweetened sodas, even diet sodas, are under attack, not just from the policies that want to limit them, but from just not fitting with the values of young people and consumers today. And so what they did, and who has used one of these machines? This machine is my most favorite thing in the entire world, even though I can't drink soda anymore. I love this machine. And what you do is you can go up to this machine and pick from like 20 different Coca-Cola products, and then you can put in different flavors, or you could like mix them all together. And what they've done is you have an app on your phone that will record the mix you create of your soda, and then it will Bluetooth that data back into the next time you go to the Freestyle machine, and it will mix up your favorite beverage combination. They didn't really change their product. This is all the same products that they make, but they did change from like just making sodas in cans to improving the kind of equipment that delivers it. I'm laughing at Michaela's text, lowercase, uppercase. Have to explain that to somebody sometime. You see the little point on the bottom of mobile app? Consumer gets their blends. Coke gets the data. The data then drives their marketing. The data then drives their product emphasis and where, right? They might realize, oh, Minneapolis is all about Sprite with grapefruit flavor. We're going to push some more like that. And yes, I see the bubbly water thread going on in the chat box. So didn't change their product, the nature of it, but they gave young people the opportunity to make their own product. How does that apply to us? Here's another example, and this is a tech product, so this is going to get a little geeky on y'all too, right? But this is a cell phone out of China. And as they were trying to innovate their form factor and their product for mobile phones, right, they knew that they were in a super, super competitive marketplace with people already owning most of it, AKA Apple. And so to develop and innovate their product, they used their existing fan community, because there's a whole group of young people who are super wed to, you know, what do these phones do? Can I customize? Can I build an app? Can I hack the security? Da-da-da-da-da, right? So they identified the fan community who exists on these boards and blogs, right? Who was talking about their stuff. And they would jump into the forums and the message boards and ask them questions. And harvest the young people's suggestions and bug fixes, right? So they'd give them product or give them software for the young people or these fans, right? And I don't know that that's a safe equation there, but and ask them what they thought of the product and got all their feedback and all their improvements from the young people who were the 10% that were really into it, right? And then as a marketing device, they'd support these same 10% to get together at events or shows or whatever, festivals, all that sort of stuff, and they would sponsor these sort of things. And the whole reason that this worked for them is that these folks, this 10% who was really actively engaged, they were going to be advocates and promoters throughout the entire rest of their lives because they had been so engaged in this product itself. Because when you're part of it, you want to own the success, and you want to be the one who's carrying the message forward. And that's how it worked for this company. All right, here we go. Here's another mashup. I got two things that we could think about. One is, okay, I'm going to come back to that comment in a second. One is, what is the freestyle Coke machine equivalent of a well visit? I know, I'm making your heads hurt. I hope you ate. If the well visit, if a visit to the doctor, right, for preventive checkup was like a freestyle machine, what would it be like? That's one thing I'm thinking is a real mashup opportunity. The other one is from that cell phone deal. If we could, if we recognize that like maybe there is a sub-segment of young people that really are digging this stuff, this whole either well visit or health or prevention or whatever it is, who are they? Could you name a group that you think would be the super fans or the super engaged in this? Who is our 10%? Who would that be? I mean, like the obvious one for me is athletes. Or is it? I don't know. Who would the 10% be? So think about that. Let's get some more ideas flowing. We're almost out of here. Oh no, we got the state. I got state examples of how the well visit is being improved and changed based on youth input. But I wanted to get your brains thinking first. All right, here we go. We got another comment here. Youth guides the visit, picks topics or at least the order in which the topics like anticipatory guidance. Yep, agree. I really, and by the way, these don't have to be realistic. We're just trying to get really cool ideas, okay? But I love the idea of young people like, at this well visit, here are my important topics today, or here's what I would like to discuss in a way. Youth interested in health careers, right on. Right on, because they're going to be natural advocates, yeah? And I see that there's HOSA, right? Iowa turned me on to HOSA. I think there's groups that already exist. Virtual well visit, yep, telephoned through their phones. I know, right? And couldn't they be, like, I know telehealth already exists, but I suspect that because it's old people doing it, maybe young people could really give us tips on how to make it actually work, you know? I don't know. I'm sorry. I have a very little window here. Interesting selling point. Make people feel they're getting a personalized. Where did it go? Man, Rena, you're going to need to help me with this window. I'm having issues. Oh my gosh! Look at all these great ideas. Okay. Make people feel they're getting personalized experience over well visits. They get to pick up a list appropriate for age group as to what they want on that visit. Love it. Sexual info, testing, immunization, nutrition, extra. Love it. Absolutely. Somebody at the COIN thing was talking about how they're doing that digitally in advance so that then the clinician has it right away. Well visit. Bringing the visit to the location they hang out in. Yeah, right on. There was a doctor at the COIN thing that was talking about that. It was like, well, if we really want to be where they're at, we should like physically go where they're at. Brilliant. Not a lot of people know their insurance. How can they telehealth, right? but see, are you serious? Like, part of me thinks like, for them, telehealthing would be way easier than figuring out the insurance system, as long as they had a login. Love the pick ahead of time because it makes it easier to bring up difficult topics right on. I always liked when my mom let me pick the doctor. Is that what that said? Use of school-based health centers. Yep. Mobile clinics like a blood mobile. Oh, you guys, this is great. Click the arrow by participants. Thank you, Rena. Oh, there we go. Nope, now I just lost it. Gosh, wow, and I'm giving this talk? Pathetic. Okay, Rena, if you could read any ones that I didn't read while I try to get my chat window back. Oh, wait, here it is. Doit. All right. Oh, I see. Oh, so much better. Thank you, ma'am. All right, I think the last one was mobile clinics like Bloodmobile. Oh, at concerts, malls, etc. Wouldn't that be cool? One of my colleagues here, Jenny Oliphant, she's like all into doing STI testing and pregnancy tests, you know, pee in a cup in a public place, just to facilitate them actually happening. I thought that was wacky 4 years ago. Now it's like, well, yeah, that makes perfect sense. Loving it. Great ideas. Thank you. Brains. Awesome. All right, so we had 23 minutes. I can't believe we're getting through all this. This is fabulous. We're going to stop in a minute. Here's what's going on now. Not surprisingly, woo, New Mexico. In addition to the work that I showed you, also run a program in New Mexico that's sort of drafting off of this, young people as the trainers of clinicians. And so they engaged a youth acting troupe, trained them to be teachers for clinicians. They all develop a character profile, learn how to engage with the clinician and provide feedback, worked with the school-based health centers, and then eventually started spreading out into straight-up clinics that were part of the COIN. Wisconsin has a similar sort of program where they've, again, engaged young people to help with the training and skill building of the clinicians and practitioners themselves. Wisconsin, I believe, would work with states who are interested in doing this themselves. Go check out Patch. And then finally, and I'm sure most people know about Michigan, but Michigan, University of Michigan has this Adolescent Health Initiative that is all about improving the quality of the clinical experience for young people, and they have a youth advisory board that has been instrumental throughout the process. I've got a little video to show you here of one of the things that they produce, and you can see the youth engagement in it, but I need to promote their resources as well. If you are considering a quality improvement process and you have more money than time or people, you can call Michigan and they will help you through any of these processes. And check it out. They've been working with Iowa, Maryland, Mississippi, Wisconsin, and Washington, D.C. So they really are set up and geared to do this work with you. And they have a great process. Not only do they do trainings, you know, in-person trainings, but they have a way of sustaining engagement with clinicians over time through these Spark training things. Really can't recommend highly enough. And again, hopefully we'll get them on the phone to share this with you as well. Let's see, it's only 2:10. I don't have that many slides left. Let's watch a teeny bit of the video, and then we will be wrapping it up with some very heady thoughts.
And I'm on the Teen Advisory Council at the University of Michigan's Adolescent Health Initiative. And I'm here to show you ways to get the most out of your healthcare experiences as a teen. As much as doctors, nurses, and clinic staff want to help, it's also up to you to make sure you get the care you need. Let's drop in on Taylor and her mom visiting the doctor.
So how are you two doing today?
We're great.
All right. And you're in for just a checkup today?
Mm-hmm. Yep. Taylor just turned 16, so it's time for her to be.
Oh, does that mean you're junior, Taylor?
Yep. Yeah.
All right. All right. And Taylor, how are things going for you at school? Do you play any sports or anything?
She's really good at hockey, and she is thinking about doing Glee Club, right?
Oh, do you like to sing?
Love it.
Okay. All right. And socially, how are things going for you? Do you have a lot of friends, big friend group?
She makes friends really easily. She's got a lot of friends.
Okay. And Taylor, how about your classes, your grades? How's that going?
I'm doing okay, but I've got a big math test next week. And is it okay if we talk alone?
Yeah, sure. We do like to touch base with our teen patients for a few minutes by themselves, if you don't mind.
Okay.
How about those eye rolls? Wasn't that awesome? There's a whole series of these. Again, run immediately to the Michigan website and look at these videos. And here's the thing: I love these videos and they're fabulous. Are young people going to find these on their own? How do we, you know what I mean? This is not an organic version. We need this, but I'm also interested in how we get it on the agenda without making it and putting it there. Does that make sense? Anyway, all of this fabulous stuff. No, it does not make sense. to see this video, a young person, what's it going to take for a young person to get there, right? If they're in Michigan, maybe one of these young people engaged with them or they heard something. No, my teen would not think this visit was worth anything so far, right? But for them to see this video that's inevitably trying to get young people to develop the skills to do their own advocacy, right? Like, I want to talk to the doctor myself or address the privacy issues and that sort of thing. Young people are going to have to go find this video versus someplace where they already are spending time that they're going to then see this kind of message, right? That could either drive them here or give them the same sort of information, but in the format that it's actually appearing in, right? I'm going back to comment sections, blogs, discussion boards, etc. PB Bunny's video stream, whatever. One of our teen pregnancy providers shows our videos during upcoming attractions at the local movie theater, right? What do you guys think? Would you throw your soda at the movie screen if this was what came on? Yeah, Instagram and PB Bunny, right? So that's all I'm saying. Like, just what Bessie is saying here, right? If you have to promote them to go to see this video, so it's a step, right? Versus having it right there that's going to introduce into them, like it's in the movie theater kind of thing. All right, excellent. Sponsored posts, yep, absolutely. You've developed teaser on YouTube or Instagram, right on, right on. All right, where are we going? We're wrapping up. It's 2:15. I can't believe it. All right, so this is a slide of mine that I've been using to discuss this whole youth engagement thing, right? And so my shtick is, okay, so, there's a million ways that you could do youth engagement. Here, look at this list, and I bet you're doing all these things, some of these things already. And, it's everything from, the clinic as a program for younger patients to young people can come in and decorate the space, and, they can be on an advisory board, da-da-da. And it literally wasn't until I was re-putting these slides together that I realized what a violation this list actually is. And it's what I'm trying to find out who said it, because it was brilliant. I want to give credit. Was it Amy? I'm not going to find it. Somebody tell me who said this. This is all what they're going to do. Not what are we going to do, right? Like, they need to step up and do these kind of things. It's all about the actions we're putting on them versus what are we doing to make us be the ones adapting and ready to do the engagement. I think that's the difference. And somebody said that right away, that putting the onus on them versus putting the onus on us to address what we're doing that keeps them out or makes it hard for them to get in, that's, I think, the difference. And that's why I'm starting to think co-creation is greater than youth engagement. But that's just my take, and I would love to hear what you think. It really is my last slide. I'm going to stay on this line as long as anybody would want to do more discussion. We can take people off of mute and actually talk in person, or you can have 15 free minutes for your life. Next month, I have actual dates here. Next month on the 9th is Relevance Equals Experiences Plus Sharing. So we're really going to be looking at how can we leverage these trends to promote the well visit. F Your Beauty Standards is on June 23rd. So we're going to look a little bit at the evolving priorities and values and orientation of young people as activists and changers of the world and what that means for our well visit. And then the last session is on July 7th, which is going to be, it's called Health Literacy versus the Lookup Generation. And again, we're trying to look at knowing that health literacy is a goal or an objective. How does that fit in knowing that we're talking to young people who essentially are masters of the technology and have answers at their fingertips 24/7. So that's the lineup. As I said, I would love to stay on the call and talk with anybody who wants to, either via voice or in the chat box. As Rena is noting, under the name of Kristen, everyone's going to get a promotion of this, and we're going to send you not only an evaluation, but a summary of these really cool ideas so you can share it with other people. These slides, all of the resources are entirely 100% available to you to do what you want with them. And if there's specific things that you want to know, it is my job to try to find them. Not always in a timely manner, but there it is. So send me a note. You know where I live now. All right, I see a note from Eileen. So I just want to thank everyone. You are free to go or you are free to stay. And maybe we'll get a tour of Reddit from somebody here. No, just kidding, just kidding.